Welcome to Leadership Chats with Dr. Wise, the Not a Lecture podcast where we explore what it really means to lead in today's complex healthcare environment. I'm Dr. Wise, and in this series, we're having real conversations about essential leadership concepts. We'll talk about what you need to know, what you want to know, and what you'll actually use in practice. And yes, what you need to know to pass the exam. Each episode, I'll be joined by a guest expert who brings real-world experience and insight into nursing leadership, from managing care teams to fostering a culture of safety and everything in between. Whether you're listening on the go or settling in with your notes, this is your chance to deepen your understanding and connect what you're learning to real-world practice. No slides, no lectures, just meaningful conversations that bring leadership to life. Welcome to Leadership Chats with Dr. Wise. Today we are joined by Dr. Joyce Batcheller, who is going to give us some insight in the world of health policy and advocacy. So as graduation gets closer, many of you are thinking about your first role as a professional nurse and what it really means to step into that role as a part of the broader nursing profession, which is a great thing to be thinking of. So today we're talking about something that reaches far beyond the bedside, yet impacts everything that we do there, and that's health policy and advocacy. Nursing has a long history of speaking up for patients, communities, and the profession, but it's also an area where we really do have some room to grow, especially when it comes to shaping the policies that guide healthcare. So Dr. Joyce Batcheller is a nationally recognized nurse leader and health policy expert, and she's here to help us connect the dots between advocacy, policy, and everyday nursing practice. Whether you've ever thought of yourself as a policy influencer or not, this conversation will show you how your voice does matter, how to use it effectively, and how even small actions can help drive big changes for your patients, the workplace, and the profession as a whole. So let's start chatting. So welcome, Dr. Batcheller. I'm happy to have you here for our conversation. And why don't we start by having you share a little bit about yourself and your background?
And thank you so much for having me today. So I think I would highlight that I've worked in a variety of settings and I've had a lot of different roles. I've been in nursing now for 50 years. This is my 50th anniversary.
Oh, congratulations.
And I can just share with you that things have changed dramatically over the years. And so when I start thinking about what's it going to look like in 5 to 10 years from now, what pops into my head immediately is where are we as nurses in helping to shape that direction? Because that's what we need to be doing. So I am originally from Connecticut. I went to a 3-year nursing program. I went into the Air Force out of nursing school in San Antonio, went back to school for my bachelor's and my master's, and then moved to Northern Virginia. My background is mostly cardiac critical care and things like that. I always liked the acute stuff. I was then recruited to Austin, Texas, and came here in '94. And I would say I gave up after about the 7th or 8th organizational chart change that I had because my responsibilities kept shifting. Because we went from being 2 hospitals with like 2 working port clinics, home care, to me becoming the chief nurse for the system and having over 11 hospitals and all sorts of different things in our system. And so when you talk about advocacy and policy, I don't think we can get away from understanding that we play a pivotal role in that. And I think that nurses everywhere can see what works, what doesn't work in healthcare. I keep saying if you just ask the nurses, they could come up with a lot of different ideas on how to really change and improve care as well as decrease costs. Sorry, it's really dry.
Okay.
Here in the area. So let me just sip this.
Go for it.
So I also a graduate of Texas Tech's TMP program, and I was in the first cohort. So I raised teeth and say we made it better for everybody else.
Yes, of course. That's awesome. Well, I know you bring some great insight from your experiences. And also, can you tell us a little bit about your involvement with TNA, Texas Nurses Association?
Yes, thank you for asking about that. I say to you that I had a lot of different roles at both the local, state, national level. And then I really got interested in running for the Texas Nursing Association board and then president role. And people were like, what are you doing that for? Because I just finished that this past June.
Mm-hmm.
And I said, because I just think this is a critical time for the profession, and we need to be at the tables with voices that are listened to.
Mm-hmm.
And so I decided to run, and I was elected. And so the first thing that occurred when I started in the role was that Dr. Cindy Zolanic decided to retire.
Oh,
So I
yes.
thought, okay. And so the first major thing was to find a new CEO.
Mm-hmm.
I was going to be in charge of strategic planning, and so it took a little bit. My philosophy has always been proceed into apprehend, and I like to run with rigor. So I like to get things done, but I
Mm-hmm.
had to slow down because we needed to find the right person. And so
Mm-hmm.
I had a great selection committee, and we ended up hiring Dr. Serena Bumpus, who's currently serving in the CEO role. But we started to do some road shows or listening tours is what I like to call them, because I told them I didn't know how to strategically plan for the state if we didn't go out and talk to people and understand what the needs are, because Texas is big
Mm-hmm.
and the needs are very diverse, as you know. And we got so much feedback from the nurses. Now, when I say nurses, it included educators and academic and staff nurses, directors, CNOs. It was people from the communities and et cetera. So it was really a broad brush in terms of who we got to hear from. And it was really apparent that workforce issues, major staffing, and linked with that is the growth that we're
Mm-hmm.
having in Texas in the new hospitals opening. And so that was really huge. And then we also heard a lot about the violence in the workplace. And and so it was really good, though, to get out and to see the different parts of Texas. And there are some very specific needs in certain parts. There were also parts of Texas that the TNA local chapter had stopped being active, and they wanted help to get back active because they needed to get their voices heard.
Mm-hmm.
And so it was fun to do that. And when you do that, you get a collective view of what people are saying in a variety of areas. And I'm all about coalitions, big groups, putting our arms together, coming up with a common voice. Because when you do that, people have to listen to you rather than being scattered and divisive. And so I think the whole thing was, how do we address these issues as we go forward and really take it to the legislative area and the whole 9 yards, which we could talk more about it in a little bit.
Yeah, that's awesome. I think that gives us a good, uh, some good context too about your involvement at that level. And as president of TNA, I know that your those road shows and the work that you've done along with Dr. Bumpus has been absolutely influential. So we'll definitely get into that more, but thank you for sharing about that. So to start us off, let's just kind of lay the foundation and develop an understanding of what advocacy is in nursing. So when we talk about advocacy in nursing, it can mean different things to different people. So how would you define advocacy in the context of nursing practice? And why is it such a critical part of our professional role?
So I think that you start to advocate, and I would imagine that all of the nursing students that are listening to this have already been advocating
Mm-hmm.
for their patients or for a coworker or a student, friend of theirs. It really is when you see something that you believe needs to be changed or it needs to be reported so that something can be done to improve it. You are indeed advocating to try to improve something and or start something new that you think could really make a huge difference. I think nurses tend to shy away from I advocate. Well, we do it all the time. I think when you put that advocate word on it, somehow people think it's foreign, and it's not. And
Mm-hmm.
even as you look at how do you identify problems, well, we do it every day. You use the nursing process, you
Right.
assess, and you come up with what their problems are. And that can be, done at a unit level, a hospital level, a system level, a state level, a regional level. I mean, the skills are the same. The view may be different that gives you a different idea of maybe a bigger depth and breadth of something that you want to change. But we're using the nursing process most times where we're
Mm-hmm.
assessing and coming up with something we need to be looking to change. And then how do you go about making a difference?
Yeah, that's a great example. I mean, it's that same cycle of I see an issue, I'm going to look for solutions, And when you bring in that advocacy piece, then you bring awareness to it that helps to broaden what the opportunities are for solutions. And I think it's great that you also pointed out that it happens at multiple levels, but we do it on a daily basis in our nursing care. So can you share a time from your career when this definition really came to life for you?
I think that I have a lot of examples, but I think the one that really resonated with me when I was thinking about this, I was in my assistant chief nursing officer role, and we had what we called a nursing congress, where staff nurses across the system came together to look at policies, procedures, and things like that. And I was struck with the fact that they were really concerned about the way physicians were behaving. And some of the behaviors were really pretty abusive, the things that they would say and do. But the part that really struck me is how tolerant they were before they would even bring the issue up. And I asked them to turn their tolerance level down because I needed to understand how often is this really happening so we could begin to address it. And so it was not popular. And I think we did this probably 18, 20 years ago.
Mm-hmm.
But I call it the no abuse, taking no abuse sort of thing policy with physicians. And that starts with us, which I also pointed out to nurses need to not be bullying each other either. But there were definitely some issues with the way the physicians could behave. And so I worked with the medical staff and our clinical quality committee of the board and others. And you can imagine people were not happy because they didn't even want to admit that physicians were behaving this way. And then some of them didn't see anything wrong with it because in some cases we had never said to them, when every other word out of your mouth starts with F, it really makes me uncomfortable.
Right.
And when you start to raise your voice with me, I can't hear you because it's too loud. Or could we take this conversation over here in this office and not have the person then feel like, hey, look at the stage to get to be on? And so I got pushback, as you might imagine. And finally, but the clinical quality committee of the board, especially the lay members, were really very supportive, and they did not want to have this kind of culture. And so that was just amazing to be able to get their support. Now, it doesn't mean that once we passed it, that everything was golden, because it never works that way.
Right.
But we started to set the stage that we were going to learn how to get along and talk to each other respectfully. And if you did, in fact, lose your temper or say something inappropriate, that you also learn, just like you were taught when you were younger, go back and apologize.
Right. Right.
Because sometimes that's all the nurse wanted was for someone to apologize and recognize that what they had said or done was inappropriate. But I would tell you also that we have a lot of work to do in our own profession for us to be treating each other more kindly and with more compassion and all of that. But that was one that was kind of fun. And basically, when they were sort of challenging me, told them that I wanted them to know that if they were in a bad mood and in surgery and they wanted to throw a surgical instrument, that they could page me and I would come and they could throw it at me because I could use a vacation at their expense on the island of my choice.
Yes. What a great way to give them that option as an
I think they
alternative.
got the point,
Yes.
but I did it in a nice way, but pointed.
Yeah, yeah, that's such a great example, and so interesting that, as you pointed out, something that in our own nursing profession, we still, after years and years and years, are working to redefine what civility looks like and what we're tolerant and not tolerant of, which I know is another conversation. But what a great example. And then something that came to mind as you were sharing your story is, everything comes down to the quality of care and the safety of the patients. And when we have a toxic culture like that, it affects the patients at the root of it. So you can always find the connection back in these advocacy moments to the patients, the profession, but at the root of what we do as a profession is to care for our patients and keep them safe and healthy. So a great example. So that is a good segue into our next question. Nursing advocacy is often associated with speaking up for patients, which is often, kind of what we're doing on a daily basis at the bedside. But it also includes advocating for our profession and the systems that we work in. So, can you share an example from your career where advocacy led to meaningful change, whether in patient care, workplace safety, or in policy?
Again, I would tell you there's a lot of great ideas that I could share with you. I think that looking at the workplace in terms of what systems work or don't work was really important. And an example that I would share, which was very devastating to me as a new leader, is when a nurse accidentally put the feeding tube into the central line port, and the central line was into the feeding tube. And uh, a nurse picked it up very quickly, was able to stop it, but the patient ended up needing to go to the intensive care unit, was very sick, and this nurse could not recover from this incident. And I tried to explain that it was really a systems issue because those should not connect.
Mhm.
A feeding tube should not connect to a central line. And back then they did. And we got that changed. I mean, it was something that once we started to investigate it, it was a bigger issue than we had identified with our own individual case. And so now you will find ports are very different, color coded. They don't fit if they're not supposed to go together. But that incident really sticks with me because he became a cab driver and he gave up being a nurse, which really hurt. As a leader, I just really tried very hard, and it made me passionate to look at what else in the work environment do we need to fix so we set people up to be successful and make it so that they can't make errors like that, because that was not something with just him. It could have happened to any one of us when you're moving very quickly. And anyways, that's an example of something that obviously has stuck with me for a long time
Right.
because that was when I started as a new director fairly early in my career.
Wow, that's a great example. And I mean, we want to have. I mean, we know that errors are going to happen, and we know that we're humans and we're going to make mistakes. But to create systems that make it harder for those mistakes to happen is extremely important. So that's a great example. Um, One of the objectives in our course is learning to identify a need for change and clearly communicate that need. Kind of an example that you just provided us. That was a opportunity where you saw the issue and advocated and made a change that went all the way to the equipment that was being used. So from your perspective, when we're looking to identify the need for change and then communicate that need, what's the first step in recognizing an issue that calls for advocacy?
So I have some favorite questions to ask to help identify those issues, which include things like, was this the best that we could do for this patient?
Hmm.
If something is keeping you up at night and you can't sleep, what is it that we need to know about it and or hear? If there's a ticking bomb on this unit and something bad is going to happen and something is going to go wrong, what would that be related to? So making people stop and think, but also giving them permission to tell you what they are seeing or feeling or worried about. But I think that you can also, which is kind of fun, is challenge people to go on a different unit and
Mm.
have the ability to just for 15 minutes only walk around the unit and take pictures of anything that you see or do that you believe is not in compliance. I can tell you we did this one day and it was horrifying to see how many pictures came back when they did this. And again, it was 15 minutes, but linens on the floors, things stacked up high, stuff being taped with duct tape. I mean, it was just all the things in some ways are potentially happening out there. But when you see it like that, then you kind of go, okay, this is way too frequent. Why is this not working? What are the system issues? What do we need to change? But it gives people permission to like really stop and look around
Mhm.
because we move so fast. And we also probably walk by things that we know aren't quite right. And we don't stop to do anything, which just means that you just said it was okay because you
Mhm.
walked by it and it wasn't okay. And then the other piece I would say is, do you step in and stop the line? It's what I call it. When
Mhm.
you see something that is happening that's not right, do you come over to the aid of a colleague and say, is everything okay? Because you see somebody raising their voice
Mm-hmm.
and getting inappropriate, that, if two people come over and one of us on each of your side, it's going to send a signal to whoever's talking to you. They need to tone down. But it's
Right.
those kinds of things that, again, they may sound simplistic, but they make a huge difference.
Sure.
And those are simple questions, though, to ask people. My favorite is really, is this the best did we is this the best that we could have done for this patient?
Mm-hmm.
You think about that and you kind of go, actually, no, we could have done whatever.
Yeah. Yeah. Those are great questions. And I would encourage the students to take note of them. And even as they're in clinical, I know they're nearing the end of their clinical experience with our program, but start the habit already of observing. Because I think from a student perspective, you see things in a different light because everything's fresh and new and you know the standards really well. So you have a good comparison to go by. And then it's great for, you know, pick your favorite question and always have it in your mind when you're at work, even starting as a new nurse, and it'll really help you to see the opportunities that might exist. So that's great. So the nursing profession has more than 3 million members in it in the US. We're a huge profession, and that gives opportunity for a very powerful and potential voice that we can use. So how can new nurses tap into that collective influence early in their careers?
I would say that they need to belong to professional organization.
Mm-hmm.
And I know that a lot of nurses will join their specialty organization if they're critical care or they're med surg or they're in NICU, et cetera. But also joining Texas Nurses Association, since that is the legislative voice that really does advocate for all nurses. And then getting involved, going to meetings, meeting people, beginning to what I call is making friends. You need a network of colleagues outside of the place that you work. And then also through that, you start to meet people who can become amazing mentors. And we all need mentors. I still have people that mentor me because I'm thinking, okay, I'm going to get in trouble when I do the following. So help me with this.
Right.
we, but it's different mentors at different points for different reasons. And
Mhm.
I think those that I have seen engage in the profession, be open to mentoring, establishing a network, they do very well. Because if something happens that really sort of shakes you, you got people right there who are
Mhm.
there to help catch you and support you and get you back up and ready to go. Just listening and knowing who to talk to. Because one person's not going to have all the answers, but they know other people that you can talk to. And I think that's one of the things that Texas Tech does very well, is we really do what I call shop our students around, meaning pushing them to look at getting engaged in professional organizations. Think about getting involved in your community, getting on a board. It could be the school board, it could be the PTA of your school. Nurses have a lot of knowledge and expertise that these boards and organizations need. And we don't always think of it that way, but we should, because
Mhm.
nurses are very educated and talented and see things from a holistic perspective that involves health. And that's what we do. We're trying to look at how to create a healthier work environments, but definitely getting involved in a professional organization, beginning to make friends. I have a large network of friends.
Mhm.
I never start with an empty piece of paper. That's just ridiculous. So, but I can call people up and go, what's the scoop on this? Or did you hear about such and such? And some of that came from the fact that when I would get a report, I would look at it and go, this is ridiculous. Who are these people? And I had to make a decision. I was either going to find out who they were, how this came about, get engaged, share my thoughts, or accept it.
Mhm.
Because if I wasn't going to get engaged, then I need to thank them for them being engaged and taking their time. And I
Right.
think that's the piece that sometimes when nurses say to me, well, I don't have any time for that. I used to say that to them, well, thank you in advance for the amazing trust and support you're giving me to make the decisions. Because if you don't come, that means whatever I decide is golden or awesome. Thank you.
Yeah.
And then they, and then they show up because they were like, oh my gosh.
Yeah. What a good way to put us. I mean, it makes you think about it a little bit because, yes, if you don't show up, if you don't share your voice, if you don't be active, then you're okay with whatever's happening, right? So that's a great example. And I think too, professional organizations, I mentioned earlier that we have 3 million nurses in the US, and we have, there's many major topics from a legislative perspective or in the profession, or when you talk about health and wellness or communities. I mean, there are many topics where the nursing voice can be massively influential, but we have to be collective in our voice. And the professional organizations really provide a great opportunity because they have processes in place to take the voice, put it together into a powerful way, and influence the conversations that are happening, in the legislature when we want to look at it from that perspective, and that can make a really big difference. So, a great place to be a part and influence that.
I'd love to share an example that illustrates what you just said.
Mm-hmm.
With the first 2 years ago, it was how to get more nurses for Nurse Day at the Capitol.
Mm.
Actually, it was 4 years ago. And the goal was to have 400 nurses, and they hit the goal. This past legislative session, the Nurse Day at the Capitol, there were 600 nurses.
Wow.
And when you see that number of nurses, people pay attention. And so the first time when 400 nurses showed up, they were able to tell their own stories about being hit, kicked, bit, and spit on, what the work issues were in terms of staffing and the growth of Texas, et cetera. And Jack Frizee, who's at the TNA, he does all of the political stuff, and he's our legal person, and he's just an amazing colleague. The phone was ringing that Monday morning, and they wanted, Jack, you need to come and talk to us. We heard loudly from the nurses about violence, et cetera. And that's when there was bipartisan agreement to have it now be a felony for anyone to hurt a care provider in any setting. And they were appalled when they were hearing directly from the frontline staff. And then also, there was a lot of support for the workforce development. And I think it ended up being $80 million that we got from the legislative group, and then another 20 from the governor, so $100 million. So part of that I sort of coached Jack and Serena is once you get that money, now you got to make sure that it's spent correctly.
Right.
And so how do you look at who's going to do what and what are the outcomes? And so we are very lucky to have a data center, and the person who runs that is really quite awesome. She remembers that my favorite data is what is the first year RN turnover, because that will indicate if we increase enrollments and help get more nurses produced, but they don't stay, we're not winning. And it's a lot of money being wasted, and then there would be needed additional steps. And so there's a statewide group that the governor has put in place to look at the workforce issues that includes lawmakers and others. So it's not just nursing talking about this, it's other people saying the same sorts of things we tend to say, but it's heard differently when it's not just us talking to ourselves and others, which is very exciting. And then this past legislative session, there's a great summary that has been developed by TNA that's on the website that Jack did that is, but in there, one of my favorites is that the staffing standards have more teeth in them. There are now consequences if you really do not put these in place, because it's been designed to really have the frontline providers involved in knowing what goes into staffing and what makes sense. How do they help look at, if we don't have enough nurses on this particular shift, what do we do? How do we prioritize what we do or don't do, what we miss, what we have to potentially decide to put on the sideline there? But all of that is much more exciting when your voice can be heard. And I think that we have been very successful the last two legislative sessions. And I think it's the energy, it's palpable, it's sort of like mission accomplished. It's just getting people really engaged, because I still believe and have forever that nurses have the answers. You got to listen to them.
Yeah. What a powerful example. Thank you for sharing that. And it's so, it kind of gave me some goosebumps when you were sharing about it, to think about how that collective voice, our legislators depend on the people who are experts in their areas to inform them what the needs are. And when the voice is so loud, you can't deny. And you, like you said, that we bring in expertise that is absolutely necessary. So what a fantastic example. So I think that is a great segue into talking a little bit more about the policy process. So many nurses have never interacted directly with the policy making process. So what are some practical ways that bedside nurses, especially new graduates as they're getting out into the profession, can get involved in shaping policies that impact patient care and the nursing profession?
When they're in their orientation, their residency program, they ought to ask how policies are determined in their organization. And could someone show us, like, what's the process if you have a question, issue, concern, or you want to make a change?
Right.
And I think that some organizations do include having a new nurse come to like their shared governance, whatever it looks like, one of their committees or councils, and so that they can see how nurses can be involved. We're getting much better at being able to use technology so your voice can be heard without having to attend a meeting in a particular building. There's ways to provide that electronically. And so even just to work through, like, so how does this go? Like, who has to approve it? Where does it go? And then even more importantly, once it becomes policy, how do you make sure the practice changes? Because that's what I used to push my team on is, okay, so awesome process to come up with the best practices, the state-of-the-art evidence-based practice. So tell me, did we change our practice? And so how do you then go out and monitor it? And why do we do the audits that we do, or the mystery guests that we sort of put in a different area to sort of see whether or not people do the real timeout in surgery, or if people see something inappropriate, if they stop the line and correct somebody. So I think that's one way of doing it. And the other is to get involved in policies that might be at a school board level. Or there was a nurse that got on the air traffic control board for the airport and initially was like, why would I do that? Well, they look at what kind of healthy food choices do they have at the airport. And if someone's not feeling well, is there a place for them to be seen? I mean, there's all kinds of things that we don't necessarily think of, but we know could make a difference, and we have the expertise. And if you don't have the expertise, you know who to go find and bring forward to show them, what it is that they should be listening to. So I think that that's a way to begin, and not to be afraid to ask somebody, like, how does this work? When you have this happen the next time, could I shadow you? And when I told you that we're good at shopping our students around, opening those doors, and I'm kind of pushing in the DNP program about you use it as a way to go talk to people you've never thought about talking to, but who said you can't?
Right.
And if you tell them that you're in school and you go to Texas Tech, I guarantee you that those doors will open, and the relationship and what happens after that is magical, and you never know until you ask. So I always really encourage, and we have a lot of graduates from Texas Tech in very key positions all over the state, which is really sort of fun to see.
Yes, I definitely makes me even more of a proud Red Raider when I see things like that, because I mean it speaks to the impact that we can make and what we're doing well here at the university, which I think is really awesome. So you talked a little bit about, you give us a great example about policy, engaging in policy work on the legislative side of things. So can you give us an example when you personally engaged in policy work within the system, kind of to tie into what you suggested about really understanding policy in your organization?
I think I would talk to you about the fact that I was the co-patient safety officer for the system with the chief medical officer of the system, and getting support for high reliability principles and practices, and really enforcing the things that we know make a difference, and improving the handoff communication, because it's very hard to sit in a clinical quality committee of a board meeting and 4 sentinel events are presented, and each one of them included information not flowing from one place to the next, and really then coming up with ways that we would change those practices to address those issues so that you could prevent those kinds of things from being missed. I think that is probably one of the changes in terms of even like the bedside report. And I know everybody doesn't love it, but there is no reason why you can't do that there, because you want to make sure that the patient and family knows the plan for the day, plan for this day. Very simple. And I know people look at me and go, oh my God, and they roll their eyes, but that is what you want to know is plan for the day, plan for this day, and making sure that we're doing the best for this patient, and the patient and the family should know about it. And I think it's an opportunity to also be sure that if the family's been one and or the patient where they've been a little rude or nasty, that we also set the stage for what's allowed and what's not allowed.
Mhm.
And that you can't have a healing environment for their loved one when there is all these stressors being put on the staff. And I think if we don't start telling that story repeatedly, there is no cleansing that they get when they come through the doors and they enter into our hospitals and clinics and other settings. So they're reflecting what's going on in society. So I think we have even more of an important role of really helping people understand what we're going to be doing. And a lot of that can be done as your team around change of shift report, or how you do handoff communications. How can we improve and make sure that everybody knows that if there's 5 of you in the room, there's 500% accountability. I'm accountable for me and the other 4 people. And if we really work together, there's a lot that could be improved, because we know that the report that always bothered me is the one that's titled Silence Kills. And it reported how many people have seen things that they know were not good, not right, but they were uncomfortable speaking up. And that's where we've got to figure out how to continue to really push. And that takes a lot of consistent, application of really being sure that you highlight great examples when it happens. You really you support people, even if they advocated for something it wasn't right. You still advocated. I'd cheer you on. So I'd rather you stop the line, even if it's not right, but you still stopped it. So we did a double check. And when we're really busy, it's when you have to really apply those principles. Because I hear people tell me all the time, well, we're really busy. Not an excuse to cut corners.
Yeah. Those are wonderful examples, and I think some really great things for students to think about in their own practice. Sometimes the culture of your organization, hopefully it aligns with the examples that you've provided, but maybe it's not. But we can establish what boundaries we're going to set for ourselves and the kind of culture that we want to create immediately around us, and implement many of the principles that you just talked about. So those are great examples. So when it comes to policy making, we talked about stakeholders. You talked about your network. That's an aspect of it. But when we look at defining stakeholders and understanding their level of influence in the policymaking process, we really want to understand who the stakeholder is. So, how do you approach identifying the stakeholders in an advocacy effort?
There's a lot online that you can start off with learning. And then I think you also recognize that you really end up talking to their staffers rather than them themselves, but you can have a conversation. I think the piece that is important is to show up when there's nothing going on, just to introduce yourself and let them know who you are, the expertise you have. Give me a call anytime if you run into situations like this. I'm happy to help you. They probably are going to be like, wow. So don't show up just when you want something. You've got to develop those relationships. And then I think you start to talk to the people that are working with you on the issue, because they know who they've come up against that has a real strong stance, who might be swayed if you were able to understand what's really at the heart of what's bothering them, because sometimes we think we know, but we don't. And so being comfortable sitting down and having a crucial conversation.
Right.
And getting comfortable talking about topics that may be uncomfortable. Being able to just say up front, Dr. Wise, this might be an uncomfortable conversation, but it's one that I really think both of us could benefit from. And so I'd like to discuss blah, blah, blah. And you start to have the conversation. You can agree to disagree. Not everybody's going to agree with you, but is there somewhere that we could come in the middle and still come out of this with some of your desires and sort of like what you've been advocating for being met, as well as what the people that I work with wanting to advocate, because it's not about you and it's not about me. It's about the people we represent and serve.
Absolutely.
And it's our constituency. And I think that's what sometimes gets lost, unfortunately, is that there's too many people just like it's about themselves.
Mhm.
And that's when it goes south because you're losing the perspective of future generations, really being able to make a sustainable change that improves the health of the people we serve in our communities.
Yeah, that's a great example. And I glad that you touched on the people that we serve, because I think that's one of the most important stakeholders that we can oftentimes just look right past. We think we know what's best for this certain community, or we have these great ideas that are going to do XYZ, but we need to bring in the people who are going to, be on the other side of those decisions that we make, whether it's a hospital system making policies that affect nursing staff, or it's creating health related policies that impact communities. It's involving everybody. Those are important stakeholders that you mentioned that help to move things forward. But we don't want to forget the patients, or those at the root of the change we're trying to influence as well. So was there a time that you can think of, or a story you could share about a time when identifying the right stakeholder made all the difference in the success of an initiative that you were trying to implement?
I would say to you that one of the things that really stood out for me is when we realized that a lot of our employees were trying to get appointments into what we called our working poor clinics.
Mm-hmm.
And that was startling. There was a lot of recognition on that wasn't what we thought would happen there. We thought that our employees were doing okay and that they didn't need to have that sort of care setting. And what it boiled down to is you start really looking at what they make and what the cost of living is, et cetera. And it led to a policy change where our health insurance was going to be prorated. So people at the top, people in other certain job codes would pay more for their insurance to assure that the employees we had that worked in food service, housekeeping, dietary, whatever positions that were not making as much money as others, they would pay less for their health insurance and be sure that they got good health insurance coverage like everybody else. And that was really awesome because we didn't really know who was using those clinics, but they're right there in our neighborhoods, and we thought we did, but we didn't. And so it really was important to go out and take a look at,
Mm-hmm.
are you really meeting the needs of the people you think you're meeting? And as the demographics change, are you going out and paying attention to that? Because you see this now in Lubbock, just like here in Austin. There are parts of the city that people never would have gone to
Mm-hmm.
years ago that are now like the up and coming areas to move into.
Right.
And so what's happening to the people who used to live there? What is the impact on that? You know, what should we be thinking about when it comes to affordable housing and other sorts of issues, the homeless population? So, you just don't pay attention to that if you don't get out and get sensitized to who's in your neighborhood.
Mm-hmm. Yeah, great. That's a wonderful example. I think, that ties right in very nicely into understanding who we're serving. And in that case too, your own employees. I mean, what a great example of how you advocated for the employees, because, we want to make sure that everybody can experience those wonderful benefits of being employed in an organization like that. So messaging is going to be a big part about effective advocacy. So, what are some strategies that nurses can use to communicate their message clearly and persuasively to decision makers, whether that's within their organization or if we're looking at it from another angle with lawmakers?
It's a competency when it comes to learning how to be succinct,
Mm-hmm.
bold in what you say, brief, and then be gone. And so, a way to start that off that gets people's attention is a story, a picture of a person that you then tell the story for, especially if it's a cute little child. That will get people listening to you differently. Or statistics that we could save $2.5 billion if we da, 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 da. So learning, like, what is it that they're going to be more likely to listen to? So people are facts and figures. Others, you want to hit them with, I always say, you want to ignite their hearts and you want to hit them in the gut so they pay attention to you.
Yes.
So, but whatever it is you do is start off with something that is startling and interesting so that they stay engaged with you, because you've got a very short time to show them that they need to continue to listen to you, and you have to learn how to be succinct. And so I coach CNOs. It's almost like I have my own set of competencies for chief nursing officers, but one of them is learning how to be a campaign manager. How do you go around and get everybody to vote for patient safety work you're trying to do, the models of care redesign you're trying to do, go for magnet? How do you do that? And you have to keep having different messages depending on the group. And but sometimes they're fun messages, sometimes it's got data with it. But whatever it is, if you got 3 key points or 4, no more than that, well, listen, you get into number 12, number 13, they're gone. No one's paying attention. So
Right.
you have to really learn how to be succinct and bold.
Oh, great advice. That's good. I think I'm going to use that in many different ways because I have some different time opportunities in my life where I need to be persuasive. So that's great. So our students learn about the evaluating the effectiveness of advocacy action. So what does that look like in real life?
So let's say if you go back to patient safety, we were on a journey in 2005 to get to zero preventable deaths and injuries by 2008.
Mm.
And so it was very clear we were very serious about this. And people understood that the senior leaders of all the sites met with the CEO for the system, the chief medical officer for the system, and myself as the chief nurse for the system. And we would go over their metrics. And so when people see that you're going to be held accountable for that, and then they know that it's real. The staff sometimes wonder, are you going to do this or are you going to not do this? And I think when you start to see transparency about how many vent-acquired pneumonias do you have, how many times have you left a surgical instrument or a sponge or something inside a patient, how many times have you had a wrong-sided surgery, you have to get the organization comfortable being transparent, because people otherwise think, it's somebody else. No, it's us. It's very real. And then really starting to show that when someone does something right, that is really getting amplified, and you can see the positive nature. And I would share with you one of the more fun stories early on this 3-year journey to zero was in one of the rural hospitals where the surgery tech told the surgeon, we are off the sponge count. And he wouldn't listen. He said, everything is fine. And she said, no, I'm telling you, we're missing 1 sponge. And he just got adamant about, I'm going to start to sew up the patient. And she put her arms straight across the sterile field over the patient and said, no, you're not. You're not going to start to suture the patient until we find the sponge. They found the sponge. And it was awesome. And that got told everywhere by the top CEO, because that's what was needed. In addition, even if she'd been wrong, we were excited that she felt confident enough to stop that surgeon and do the check, which was really applauded. I also told her that I thought she needed to come up with her favorite restaurant and tell him he owes her a big expensive dinner,
Yes.
because she saved him a whole lot of hassle,
Yes.
and certainly for the patient. And so you could just imagine her pride, and that's palpable. And it's that pride and ownership is what you want to get going throughout the entire system that you work in.
Oh, that's awesome. And it's empowering too, I think, because, once somebody sees that somebody else can do that, then they're like, well, I mean,
Yes.
I want to do the same thing too. So that's
Yeah.
awesome. So let's kind of segue a little bit into building your role as an advocate. So some nurses hesitate to get involved in advocacy because they feel like they don't know enough, or it's not their time, or it's not their lane. We come up with different reasons, but a lot of it's kind of rooted in maybe a little bit of discomfort in or unfamiliarity in that area. So, how do you encourage nurses to step into these conversations with confidence?
Think that we totally underestimate what we know,
Mhm.
what we do, the things that we see, our ability to very quickly go, if you just did this, and this, you could make this 10 times better. Nurses do it all day long when they're working. I think some of it is we have to make sure that they know that they've got a lot to offer. And if you look around, the people that sometimes are serving in these roles, they haven't really done the things that nurses do every day. They don't understand the environmental impacts. They don't understand the issues around distance when people live in remote areas or the way the technology could help something. So I think it's like take that leap of faith. And again, have a friend that could be a mentor to you if you have questions, issues, or concerns, but get engaged and try it. Because I think once you do, people are going to start to go, wow. And I think there'll be a lot of positive reinforcement when they see that, in fact, what they do every day is not known to a lot of people.
Right.
And when they do see and hear nurse articulate things, they're wowed by them. And we don't get enough wows on a daily basis in our work settings. But outside of the work settings, I guarantee you they're going to get more wows because of what they know and do and can quickly come up with solutions because nurses are highly inventive.
Mm-hmm.
I was teasing about how when I first started in critical care, one of the things that I always carried with me was my little screwdriver
Yeah.
because we used to have to calibrate the machines, the monitors. What was biomed? We didn't have biomed back then.
Uh,
And I was really good at it, just fixing up the little screws so it would all get calibrated to zero again. And people look at you and go, oh, wow.
yeah. Yeah.
we we figured it out and we just kept going. And I think that we are sometimes our own worst enemies because we don't look
Sure.
in the mirror and go, I'm good.
Yeah.
I have a lot of knowledge and I have a lot to offer. I
Yeah.
know what these children need. I know what this elder couple needs. I know what's happening in this setting and I have ideas. So go for it.
Yeah. What a great encouragement. We need to move forward in confidence and being, you know, uh proud of the knowledge and the expertise that we have. And it made me think about too when you're talking about how inventive nurses can be. I know this is kind of a different conversation, but just to touch on, there is a massively growing field of nurse entrepreneurship right now where nurses are taking some, they're not just thinking of these ideas and hoping somebody else comes up with them. They're saying, you know what, I've got it and I'm taking it. And so they're providing
Yes.
solutions that maybe have been needed for a long time or new innovative ways of doing things. And I would encourage students to look into nurse entrepreneurship. It's a big thing right now.
It is. Well, and Johnson & Johnson does these quick fire challenges.
Mhm.
They go through listening and looking at different ideas that nurses have and then fund them
That's
so
awesome.
that they can actually get their idea to become real. And we've given away a lot of intellectual property to vendors over the years who then came up with these new solutions that
Hmm.
were all nursing ideas. And you might have gotten a little pat on the back while they're making millions of dollars off of your idea. So I think nurses are starting to find out that, hey, there's
Yeah.
ways for me to do this. I also would share with you that one of the things that did happen during COVID that was good is some organizations put their own little mini Shark Tank sort of forums in
Hmm.
place for inventive ideas. Some organizations are still doing that,
Hmm.
where they want creative ideas coming forward and benefiting the employees, where they get a certain amount of dollars for whatever it is that they come up with that might be a cost savings, et cetera. Again, it goes back to, do you believe that your team have the answers? And I have always believed that and believed that my job was to remove the obstacles, help plant the seeds, water them, put fertilizer, get the sun shining on it more so that they can grow and remove barriers if one occurred. And I was not disappointed when I
Hmm.
would see them take off with things that they were doing and creating. And it was way beyond what I could have ever done on my own. And I
Sure.
used to always say to them, I have the privilege of showcasing the work you all do.
Yeah.
And And it's not just me. I certainly needed to be there advocating and all of that, but it was sort of fun to watch them get unleashed and sort of have the confidence to go. And I could sit and kind of watch and go, this is awesome. I did that a lot to a point where I met with my boss and said, I work hard behind the scenes to pull this right. I'm still here.
Mhm.
And he just laughed because some people get nervous though when you start putting a lot of other people in the spotlight. And
Right.
for me, that's where my joy comes from.
Oh, absolutely. And what a great, kind of taking this a step back to just look at good, solid leadership principles. I mean, you can get so far by empowering others on your team because as a leader, we don't have all the answers. And honestly, if we go into whatever leadership role we're holding with the idea that we have all the answers or we're expected to, then we miss a lot of opportunities. And we really don't. One of the opportunities that I think that's so huge that we miss is the ability to really build up and empower our team. And when the individuals can put forth their best that they have to offer, and that is valued and used on the team is so much more productive and satisfied and happy and engaged, and wonderful examples of leadership principles to implement at any level of leadership. So,
It's so
uh,
funny because I actually had 5 nurses. I'll just share this, and this was with a
uh-huh.
different university, but they were going to go to the nurse informatics program. So they called up this university and said, there's 5 of us that want to come to your nursing informatics program, but we need a discount in order to attend because we don't get enough tuition reimbursement to cover all of it. They negotiated a discount on their own, the 5 of them. And
That's awesome.
I just laughed when they told me, and I'm like, isn't that cool that they took that initiative and they
Yeah.
tried and they got what they asked for? You don't know unless you try.
Right.
And so they then were passing that precedence on when there were other nurses wanting to get their nursing informatics degree. There was then an amazing team
Mm-hmm.
of nurse informaticists that I was like, oh, wow,
Yeah.
that we needed, but they were able to help me get them trained and educated, but they did it on their own. It
Yeah.
was just
That's awesome.
phenomenal.
That's a great example. Okay, we talked a little bit on professional organizations earlier, but they play a big role in amplifying the nursing voice. And we might get a little bit repetitive here, but do you have anything to add for students and early career nurses on identifying the organizations that will be the best fit for their interests and goals? Because we all kind of have a personal drive towards a certain direction of what we're passionate about. But what are your recommendations for identifying the best professional organizations to get engaged in?
I consider it in the following way that if you're looking at what's really good for nurses, no matter what you are, what kind of a specialty you're in, then I think that A&A and TNA here in Texas is great. If you're in a specialty, like I was critical care, I belong to the American Association of Critical Care Nurses. I'm still a member. My membership number starts with 0000. So I've been around for a while. But I love what they have and continue to produce in critical care. When you move into leadership, you need to then really join the American Organization of Nurse Leaders and your
Mhm.
local, like we have Texas Organization of Nurse Leaders here in our state. Then you'll find other special interest groups because there's one that's there for the med surg nurses. You've got the perinatal nurses. You've got AORN is phenomenal when it comes to the OR. So a lot of the specialty organizations are also places for people to go to. And again, you really learn what's going on in that specialty. And so what I find that's sort of troubling is that because we have so many different kinds, sometimes our collective voice at the national level is not as strong as it could be
Yes.
because we don't bring them all together. And there is work that goes on with the various nursing associations to try to really have, like they call it a tri-council, but it's more than 3 associations, to have more of a collective voice. And then I've learned, like the National League for Nursing, Dr. Bev Malone is phenomenal what they're doing. And they're really looking at education issues, but she's also looking at things across the world.
Mm-hmm.
And I think there's a lot for us to learn from each other, not just here in our own country, but what other countries are doing, because they're
Right.
they are much more innovative sometimes because they have so much less that they
Sure.
have to be able to figure it out. So I think some of it depends on where you are in your career, but I think you want to get curious
Hmm.
and explore them. And it's not that much money. A lot of them give you like CEs and other sorts of benefits that help you to really have a return on investment for the dollars. But again, it's that priceless when it
Hmm.
comes to building a network and having mentors and people who know, hey, you want to move into a different sort of role, or you're ready to be promoted into such and such. I got the right person for you to talk to.
Yeah,
And that's how a
exactly.
lot of that happens.
Right.
Trust me, is who knows whom and who they end up pushing forward and supporting, and
Mhm.
even just knowing what's out there. Because the number of jobs that exist today, and you mentioned like the nurse entrepreneurial organizations, they weren't around when I first graduated from nursing school. Quite the contrary. I often say when I graduated, our standards things were there were no computers. The only mouse I got was a dead one that my cat brought home. But you had to have a black ink pen and then red and blue because we had different colors for different shifts. Blue was daytime, black was nighttime. The red was for connecting the dots between the temperatures on the TPR sheet. So if you
Mhm.
think about where we're going to be 5, 10 years from now, it's like having artificial intelligence, robots.
Right.
It's going to be amazing. And we're going to need to be involved because if you want to look at policy impacts, you should have the students check out China announcing that they have the first artificial intelligence hospital. There's
Mm.
robots and everything was done with AI and robots. It's
Wow.
fascinating.
Yeah,
Mhm.
that is. And I think too, it's important to stress that um there's not like a timeline on this. You graduate, you join, get involved. And then also to just kind of accentuate what you said about relationships. Relationships are going to be everything. And as big as the nursing world is, it's actually also very small. So you want to
Yes, it
build those
is.
relationships for the positive benefit. You want to maintain
Yes.
those and know that they're going to benefit you in the long run. So that's great. Um, Looking ahead, what are some of the most pressing healthcare issues that you think nurses should be watching and prepared to advocate for in the next few years? Maybe within a year, 5 years, 10 years. What comes to mind for you?
Artificial intelligence and how it gets used, and being at the table as an advocate for how we can take a lot of the burden off of the nurses. And I imagine having my own Rosie the robot from the Jetson commercial TV series that was cartoon like years ago. I
Mhm.
would love to have my own robot that could go around and do a bunch of stuff I don't want to do, so that there's more time for thinking and actually connecting with patients, because I think we've lost that critical thinking and the fact that I make you feel like you're the only patient I have right now to focus
Mhm.
on. And getting that caring and compassion, I think, would come from getting rid of a lot of the tasky things. The other thing will be the whole ability for us to really look at the genetic makeup and
Mm.
what's going to happen there. Because I just think the moral issues that are going to potentially be coming at us is going to be
Right.
very interesting. And then I think right now too, what the impacts will be
Mhm.
with the changes coming out of DC. And they're very real when you start to look at the number of people that you have in your community that are currently on Medicaid, or they're on some sort of assistance that is being cut, or Social Security changes that might happen. I think the VA is already working with their veterans to look at the decrease, but access to care has already been a major issue. It's going to become more challenging. So, how do we get at those tables to make sure that those human stories are told, and
Mhm.
that we can help to come up with innovative ways to use all of this to make things more effective, more efficient, cost less, but be better. And
Mhm.
we have the brain power. What we haven't been doing is having the people with the brain power, in my opinion, sitting down and really looking at how do we do this together instead of making big cuts and then figuring out how to manage the chaos.
Right.
And I think that's going to be a challenge for us.
Right. Yeah. I think those are some great examples. Um, if you could give our graduating students one action step to start engaging in advocacy on those particular issues that you've mentioned, from right now and right here, what would it be?
Again, I think that professional organizations involvement would be great, but I think in addition to that is go out into the business literature, take a look at what's happening there, because the business world has a lot of things that are coming up that are going to hit healthcare.
Mm-hmm.
And sometimes we are, I mean, we all know we are not the most like early adopters of everything, but there are early adopters within healthcare that are doing some amazing things. I think getting that sort of broader perspective would be really, really good. And then wherever they live, looking at what's going on in their community, what are the top challenges that they potentially could get involved in helping with? And if there's something that's kind of a pet peeve, is there something you can do to change it? Because stop being irritated by it, do something,
Yeah.
and be able to make a difference in there. And then recognizing that nurses sit every single part of the continuum of care. If we could put that collective knowledge to good work, I think that would be great. But you got to have people at the tables, their voices being listened to. And so, yes, sometimes it's volunteer time. It's not that you're going to get paid time and a half, but it's the professional responsibility that we have. And I'm somebody who you may have been able to tell as we've had this discussion. I like to be in charge of my own destiny. I don't like people telling me always like what to do and how to do it, et cetera. I understand. Sometimes I had to do that because I was told, and I would be supportive even if I didn't like it. But overall, where you want me to go, I used to say to my boss, don't tell me how, just tell me what I got to get to. And then I'll work with the real people and we'll figure it out. And I know you'll be pleased. And then I
Yeah.
go meet with them and go, we got a lot of work to do. So,
That's a
because you got
great
to
example.
produce, you got
Yes,
to
exactly.
produce.
Yes, yes. It's one thing to say something about it, but then you got to actually, come back and follow through. So, you've given us some amazing examples and context, and just the conversation about advocacy has been really powerful, and it really shows us that nurses can influence change at the bedside, in our professional organizations, and even at the policy level. And that policy level meaning locally in our state, across the nation, and who knows, even across the world. So, that thank you so much for the insight. So, I promise students that I will come back and connect the dots for how this kind of stuff shows up on exams, because I think it can be exciting. But at the end of the day, yes, we do test over this knowledge. So it doesn't, advocacy is going to show up on the NCLEX and NCLEX type questions in a few different ways. So um, it will probably be woven a little bit into kind of patient care scenarios or questions about resource allocation, maybe communication with the healthcare team or identifying an issue. So I've got a few practice questions that we can go through. And Dr. Batcheller, would you be willing to take a stab at
Sure.
these questions with me? So awesome. Let me share my screen here and we will get those going. So what I'm going to do is, in case we have anybody listening who is not watching at the same time, I'm going to go ahead and read the question and read the answers. And then we can talk through what you think the answers might be. And if you don't mind kind of thinking out loud, that gives us a little insight into how you pick the answers you pick. And then we'll just go from there. So, question number one, we have a nurse who is planning to engage in health policy advocacy activities. Which action taken by the nurse is the most direct application of health policy advocacy? Is it A, maintaining client confidentiality, B, watching the news to understand politics, C, performing community assessments, or D, interacting with decision makers?
So, and I don't know if this will be right, but I would go with interacting with decision makers
Okay.
because you have to maintain confidentiality. That's understood. But, and I don't know if that's right. You could tell us.
Sure. Well, I'll go ahead and tell you that yes, you are correct. So, When we can kind of talk through a little bit the rationale in each answer choice to make sure we understand why we wouldn't pick the certain things that you see listed here that were not correct. When we think about maintaining client confidentiality, that's just a legal and ethical responsibility that we do under HIPAA and the Nursing Code of Ethics, and because it's right, it's a core nursing principle. But it's not going to necessarily directly impact health policy. When we look at watching the news to understand politics, I mean, there's different avenues that we have available to stay informed. And you might want to understand a little bit the political climate. But once again, this is not going to be something that's going to be a direct engagement in health policy advocacy. And then when we look at C, performing community assessments, that goes back to the stakeholder conversation, getting an idea of what the needs are within the community is an important step, and it supports advocacy by providing evidence, but it's indirectly supporting that process. So yes, when we look at interacting with decision makers, this is involving this action in order to create, change, implement the policies that exist. And these decision makers might be legislators, government officials, organizational leaders. And it gives us the opportunity to share our expertise, just like you very eloquently explained to us, present evidence, and advocate for the changes that are going to impact our patient care, our communities, and the nursing profession. So I feel like this question was almost directly written according to the information you're going to provide that we didn't even know you were going to provide in that context. So that's a perfect application. So out of the options here, that is going to be the most direct way that we can influence health policy. So, all right, let's move on to question number 2, or anything else you want to add on this before we move on.
Oh, you did a great job.
Okay. Okay, so number 2, a community health nurse is part of a team that plans to propose a policy that improves access to primary care. Which action is the first step in becoming competent as a policy-making advocate? Is it A, developing a proposal for the policy, B, locating the current level and jurisdiction where an idea can be introduced, C, calling legislators, or D, posting about the issue on social media?
I would go with B, is
Okay,
just trying to figure out where this issue really needs to be discussed. And
sounds good. Correct. You got it. Yay. You're 2 for 3. So that's awesome. Okay. So when we look at the questions asking us about which action is the first step, so that's something we want to keep in mind as a key word, but also related to becoming competent as a policy-making advocate. So when we look at option A, developing a proposal for the policy, creating a proposal is important, but that comes after we understand the policy making structure and identifying the correct jurisdiction. I think back to what you also said about being able to correctly succinctly share whatever it is that your concern is, but you might have 2 or 3 versions of that based on who you're talking to. So it's really important to know that the proposal is going to be within the proper venue for who you're talking to, and not a wasted effort or ineffective in that advocacy endeavor. So when we look at B, locating the current level and jurisdiction where an idea can be introduced, before we engage in policy and advocacy activities, we need to understand how the policy process works, including where the decision-making authority lies, and also determining the correct level for the policy that we're trying to influence, whether that's local, state, or federal, which is part of looking at what that jurisdiction is. That helps to know that we're targeting the appropriate governing body or organization and increasing the likelihood that we're going to be successful in this process. So this is going to be our first foundational step. Contacting legislators is an active part of advocacy strategy, but it's not going to be our first step. We need to know who the right people are to contact, and that comes within that understanding the level and jurisdiction. And then lastly, posting about the issue on social media. I'm sure you might have a few thoughts about this particular one, but while social media can be a valuable tool for raising an awareness, it is not a substitute for formal policy engagement. And if we post without a clear understanding of the policy process in our jurisdiction, we could actually lead to misinformation or advocacy that doesn't reach the correct decision makers. So, do you want to add anything on that particular on the question as a whole, but especially about the idea of posting our issues on social media?
Well, I think you have to be very careful when you're doing the social media because I would just reinforce that employers look at social media to see, what your tendencies have been. And you are still representing your profession. And there are things that I think sometimes nurses are naive that are in the code of ethics that you're held to nationally. And if you're mad about stuff, there are appropriate places to vent those things versus social media. So it's kind of like what kind of image are you trying to portray of yourself?
Sure,
It
sure.
can be very powerful to generate interest and compassion and all of that, but it should be used correctly. And there's a lot of crazy things out on social media.
Yeah. I think nurses are doing a pretty good job at in some regards damaging the I don't know, the outward perspective of our profession by
Yes.
maybe going a little crazy on social media at times. So anyway, very good
We
points.
talk about that because we've been the most trusted profession for years now.
Hmm.
And are we eroding that, to your point, Dr. Wise, by putting some of these things out there? And and I don't think it reflects the whole or the majority of nurses. And
Yeah,
I think that's unfortunate that it happens. But, everybody's had bad days, but there's places
sure,
and things to do to vent that are more appropriate.
sure, absolutely. Those are some very good things to think about. Okay, we have one more question left. A team of school nurses is planning to advocate for students who will be affected by a proposed law. When should the nurses plan to analyze the law to advocate for the students? Select all that apply. Everybody's favorite format of questions. So, the options here we have are when the bill is proposed to the legislature, when the bill is being developed by legislators, when a percentage of students has been affected by the law, when parent and teacher organizations post about the law on social media sites, or when the executive branch signs the bill into law. So, what are you thinking?
Well, if you're looking at planning to advocate, you're not going to wait until it's proposed. That's too late. I think you're going to do B, which is develop it. You want to be
Okay.
there, excuse me, as the legislators are building it and, and using the data, and C would be important. Um,
Okay.
so I'd say B and C. The other ones are, yeah.
Okay. So, I actually have here A and B. So, let's take a look at the rationale and see what the rationale is for the question and some different ways that we might look at these. So, just to kind of highlight again, when should the nurse plan to analyze the law to advocate for the students? Because we're looking at a nurse who is advocating um, for how students are going to be affected by a proposed law. So trying to get myself here in the right frame of mind. So when it comes to A, once a bill is formally introduced, then advocates can review its language, assess its potential impact, and begin targeting efforts to influence the legislative process before it progresses further. It's a key stage in preparing testimony, meeting with legislators, and mobilizing stakeholders. So that's why this is considered as a correct answer choice here. Do you have any thoughts on that?
It says proposed, excuse me. It sounds like it's already kind of a done deal.
Gotcha.
And I was reading this as planning to advocate. So you want
Uh-huh.
to influence what goes into it before it gets there.
Right, right.
So that's why I was not thinking that was correct. But if it's from the NCLEX people, it's an amazing answer.
Well, sometimes this particular question, I'm not sure, I can't remember where I got it. Some of them I had to kind of craft myself. So it could be me not writing a very good question, but
Oh, no.
it's a good point to think about, right? So when you do really look at the life of a bill, I think there's some cartoon about that. But anyway, when you look at the life of a bill and where we're going to inform it, yes, we want to make sure that before it even gets into the legislator that it's been accurately informed. So a good point there. All right, for B, which is correct. Engaging early during bill development is going to allow nurses to contribute expertise and influence the bill's content before it's finalized. This proactive involvement can shape provisions to better meet student needs and improve outcomes in this situation. And so that it does, speak to we're advocating in that early planning stage when the bill is actually being developed. For C, okay, this one says when we're waiting until students are already affected means the bill has passed and is in effect, making it too late to influence the legislation itself. And at that point, efforts would shift to mitigating negative impacts rather than preventing them. So,
You know what? I misread that because when I read it, I was thinking percentage of students have been affected by whatever it is you're trying to make a change on. That would be wrong. I
right.
think what you said is correct.
Okay. And you know what? That only makes all of us feel better because every one of us had has situations on exams where we,
Yeah.
you
Well,
know,
yes, I was going to say you
miss a
go too
word.
fast with your
Mm-hmm.
reading of it. Yep.
Yep.
But
So we'll just use that as a reminder for all of us to make sure
yeah.
we, take our time. But no. Okay. So then for D, social media awareness can be helpful for advocacy, but timing
Mhm.
advocacy solely based on that is risks missing earlier opportunities to influence the legislative process. And so that advocacy should start during bill development or proposal stages and not only after the public discussion emerges. So that was why that one is incorrect. And then for E, when the executive branch signs the bill into law, well, once the bill is signed, it's law. So at this stage, advocacy is to change the legislation is too late. So we definitely want to catch it before then. We'd be shifting to policy implementation or pursuing amendments to future legislation at that time, if that was the case. So, all right. That was very helpful. So thank you for doing that with us. Can I ask you one last question?
Yeah.
I like to ask all of my guests, what is the best advice that you've ever been given?
That it's all about relationships. I had a boss who I adored and was so grateful that I had her as a mentor early in my leadership development. And I asked her one day, because when we used to meet as directors, we would talk about like, how does this person seem to get away with other things better than this one? Because this one always seems like they smoothly can go along, and the other person seems like it gets stopped every time they try to do something. So I asked her, how do you get away with moving things which seem to be faster, easier for you than others in your role? And she just smiled and said, it's all about relationships. And I've never forgotten that. And it is. And I also would tell you that it's easy to say that, but you have to think about how do I make time for my important relationships? Because you don't just say, Dr. Wise and I have a relationship and I never speak to you again. You have to keep up with how are things going? Is there something I can do? I want to give you kudos about such and such. It takes very intentional time, energy, effort. And that becomes even more critical when you're involved in these like board sorts of things or policies. There's a lot of other people outside of your organization that you start to develop relationships with, and you want to keep those.
Right.
And I will give you one small example if I could. You know, I have taken my DNP project from an idea to a business where we do development of new chief nursing officers as a result of a relationship with a colleague who I helped, her and her other people that she worked with. I was helping them and I did it free, I was like, sure, I can help you with this. I can introduce you, etc. Make a long story short, I ended up finding out they were helping a foundation, a person at foundation figure out how to spend their money, billions of dollars in wanting to make a difference in nursing. And I just got a 3-year grant
That's
as a
awesome.
result of her opening the door for this foundation to see what we're doing and them challenging us to scale up. And so I share that because when people ask me, so how did you do this? All about relationships.
Mm-hmm.
And I took her out to lunch just to say thank you because I know she's been an advocate, but you never know
Right.
when those opportunities can present themselves, but it's about relationships, and you do for others and then they'll do for you. It's important.
Absolutely. That's such great advice. Thank you for sharing that with us. Dr. Batcheller, your expertise and your stories today have been wonderful, and we appreciate you sharing them. Your insight into how nurses can engage in health policy and advocacy makes it clear that our influence extends far beyond the bedside. We've talked about identifying issues, understanding the legislative process, taking intentional steps, which is very important, to making sure that our voices are heard in ways that will truly shape the care of our patients in our communities and also just our profession as a whole. So, to our listeners, I know that graduation and practice is just right around the corner, but remember that your role as a nurse comes with the privilege and the responsibility of advocating for others. So, whether you're joining a professional organization or you're contacting decision makers or working with others to develop a proposal, you have the knowledge and a perspective that can make a big difference. So if today's conversation sparks some new ideas, take one small action to move from those ideas and those thoughts to advocacy. And that's how real change starts. So thanks for joining us for this episode of Nursing Leadership Chats with Dr. Wise. And until next time, keep learning, keep leading, and stay curious. Thank you.